You're listening to OET Roleplay Practice with Kev, the English native.
Hello. It's Kevin here, and welcome to episode number 3 of my OET podcast series. So, welcome back to the English Native podcast, OET Speaking Roleplay. This is a show that helps healthcare professionals, especially doctors and nurses, prepare for OET. So in today's episode, and this is Roleplay Card number 3, we're going to listen to a roleplay between a doctor and a patient who's worried they might have diabetes. This consultation is a great example of how to gather information, respond to patient concerns, and explain the next steps in clear, supportive language. As you listen, pay attention to the way that the doctor uses empathy, reassurance, and clear structure. All key skills of a high-scoring OET speaking performance. As I've explained in episode 40 of my podcast, that's on the English native, about how responsiveness, or a lack of it, is one of the reasons why people get low scores. Even if their English is perfect, you need to be responsive, empathetic, supportive, and always explore. Take the opportunity to explore based on what the interlocutor or patient says.
Good morning, I'm Dr. Katya, one of the doctors here today. Could I check how you'd like me to address you?
Morning, Doctor. Just call me Mr. Taylor, that's fine.
Thank you, Mr. Taylor. So tell me, what's brought you in to see me today? Take your time. Start from when you first noticed things changing.
Well, over the past few weeks, I've been feeling really tired and generally unwell. It's been getting worse, and I started to get worried.
I see. Could you describe in a bit more detail what you've been experiencing?
Some days I feel dizzy, other times I get really thirsty, and lately I've noticed I'm short of breath. My skin's been itchy too.
Thanks for laying that out. On a typical day, when is it at its worst, morning or evening?
Usually later in the day after work.
Thank you for explaining that. I can hear it's been troubling you. How has this been affecting your daily life?
To be honest, it's been quite hard. I've got a busy office job and 3 teenage kids. It's stressful and I don't have time to exercise.
That does sound like a lot on your plate. Any recent changes at work or home adding to the strain?
Work's been hectic with deadlines, and the kids, of course, taking them to activities, etc.
That makes sense, and it's understandable you're feeling run down. How have you been sleeping recently?
Not very well. I toss and turn most nights, and even when I sleep, I wake up unrefreshed.
I understand. And how about your diet? Regular meals or a bit irregular with work and family?
Honestly, it's not great. I grab fast food and sometimes skip meals.
Thanks for being so open. That helps me see the bigger picture. Just to clarify, are you worried these symptoms might be due to something specific? What's your main worry right now? Long-term complications or how to manage day-to-day?
Yes, I've seen a lot in the news about diabetes. Do these symptoms mean I've got diabetes? I'm worried about the long term.
It's understandable to be concerned. The symptoms you've described could be linked to diabetes, but they can also be caused by other things. If it does turn out to be diabetes, the good news is it can be managed effectively. Does that make sense so far, or would you like me to go over any part again?
That helps. If it is diabetes, what would the treatment involve?
Great question. Diabetes is a condition where the body struggles with insulin and blood sugar control. In type 2, treatment usually involves changes to diet and activity, working toward a healthy weight, and sometimes medication.
Right, that makes sense. I suppose it sounds manageable, but I'm not sure what to do next.
Of course, and it's natural to feel uncertain. The next step is straightforward. We'll arrange a blood test. Once we have the result, we'll meet again to decide together on the best plan. We'll go step by step, no rush. How does that plan feel to you?
That sounds reasonable. So I just do the blood test and then come back here.
Exactly. In the meantime, it would help to try small lifestyle changes, short walks, and gradually adjusting your diet. Even small steps make a difference.
All right, I'll get the blood test done and book a follow-up.
Let me pull this together in 1 minute so everything's clear. You've had fatigue, dizziness, thirst, and some breathlessness. We'll do a blood test, review the result, and plan care together. If the test does confirm diabetes, we'll agree a simple starting plan and build from there. Diet, short walks, and, if needed, medication, with regular check-ins so you feel supported throughout. Does that all sound clear?
Yes, doctor. Thanks for explaining everything.
Is there anything we haven't covered today that you'd like me to explain?
No, I think that's everything. Thank you.
If anything worries you before the blood test, just give the clinic a call. We're here to help.
Thank you, doctor.
You're welcome, Mr. Taylor. We'll support you through this and I'll see you once we have your results.
So, that's the end of today's roleplay. I hope it gave you useful phrases and strategies you can apply in your own practice. If you found this episode helpful, make sure to subscribe to the podcast. Share it with other OET candidates. If you need a lesson, you can find me on italki. Link below. You can get all the transcriptions and the roleplay card, along with the annotated guide that maps the clinical communication skills to the transcript. You can find that on theenglishnative.com. If you want to connect with me on LinkedIn, just search for Kevin Anthony Dean, English teacher, and you'll find me there. So thanks for listening, and I'll see you in the next episode. After these first 3 doctor responses, it's the nurse's turn. I'm going to do the first 3 cards for nursing in exactly the same way. So, hope that helps. See you next time.
Thanks for listening to OET Roleplay Practice with the English Native. Join me next time for more practice and tips.